Hello, everybody. This is Dr. Anjali Agarwal, consultant physiotherapist, lifestyle consultant, heart manual facilitator, and women's health specialist. Today, I'll be talking about one of the most important topic, which is very important for the year 2020, especially for our physio friends and our patients and anybody who has been treating COVID 2020 or the COVID-19. The topic which we'll be talking is called as pulmonary rehab protocols as to what we do in the rehab settings when it comes to pulmonary rehab. Now, what is actually a pulmonary rehab and for what kind of situations do we prescribe this protocol to the patients? So, generally, in circumstances like COPD, chronic asthma, pulmonary fibrosis, cystic fibrosis, we generally recommend pulmonary rehab, which is a 8-week program where our patients get exercise, nutrition, psychological assessment, and counseling, how to manage an event of breathlessness, how to taper their doses and look at their medications, pharmaceutical management of their breathlessness, and how and when to consider to look at they can improve their oxygen capacity or their capacity to breathe well. So, this is a comprehensive protocol which we, as pulmonary rehab physiotherapists, prescribe to our patients who have a lung disorder or who has a cardiopulmonary disorder. Uh, Having said that, we used to run this program in the UK and we were doing it in GP surgeries where patients with chronic pulmonary obstructive disease, lung fibrosis, people on long term use of oxygen would come to us and we would do it in an outpatient setting where we would have a 8 week schedule for them, and the 8 week schedule would start from the first day when we do the 6 minute walk test. We assess the patient's lung capacity, breathing capacity, how his activity of daily living, his quality of life, and his hospital anxiety depression score. Somebody who's not been able to walk well, or somebody who's not been able to do his activities on his own, or is dependent on other people or being for simple tasks, it takes a toll on their mental health. So all that comprehensive protocol is what we will be running in the pulmonary rehab protocol. So this is Dr. Anjali, and you can always reach out to me for anything which is related with pulmonary fibrosis and to increase and help you with breathlessness, help you get your lung function back, which how you started and how you should be after the SAID program. That is our goal, and we would want to give you the best results. Now, let's look at the thing of how our lungs function. What is the simple task of the lung? And any child, if we ask, they would say the gaseous exchange, just the oxygen and the carbon dioxide exchange is what happens to the thin walls of the alveoli, which is like a bag-like structure, and in that we have lot of thin pulmonary alveoli and thin surface from which the gaseous exchange happens, and it's loaded with blood where the blood comes and brings in our impure blood, and then it takes away by oxygenating, it takes away our impure blood. So there's a mucus gland there, the mucus lining there, all facilitating and a lot of connective tissue in that area. So what's happening in the case of COVID-19, we see the surfactant, which is important for the gaseous exchange in the alveoli sac, is getting damaged or is getting fibrous. As a result of this, the oxygen exchange in between the alveoli sac and the thin layer is not happening, and which is causing primary long-term scarring of the lung tissue. So we deal with pulmonary rehab for a COVID-19 patient in similar grounds as we do for somebody with a chronic obstructive lung disease. Now, the common factor which we talk is breathing. What is a breath? Breath involves simple two terms: inhalation, expansion, and exhalation and contraction. So we have a muscular structure called the diaphragm, which separates our chest from the abdomen. And when you're breathing in, your diaphragm descends. And when you breathe out, the diaphragm domes up to exhale out the carbon dioxide. Now, in any kind of breathing issues, we see the diaphragm doesn't really move well, and that is what causes a lot of issues with phlegm and mucus being collected in the lung tissue. So we would look at what we could do in simple, very basic terms about the breathing exercise I'll be terming at is you got to relax your neck and your shoulders should be free, because if it's not free, you're tightening it up. The amount of oxygen which should go in or the amount of inhalation which you will be able to take will not be up to the mark. So you kind of breathe in through the nose, one, two, and as you do, perk your lips like you make a lips like a pursed lip, and breathe out one, two, three, four. So you can imagine that there's a candle right in front of you and you are trying to blow it, but the candle is not just going off. So it's not a forced breath, it's a very calm breath. By doing this, the diaphragm, the alveoli, they all tend to open up, and it's a very healthy way of breathing. Now, basic things about oxygen sats. Now, anybody would say my oxygen is 100%, I should be fine, or my oxygen is 95%, I should be fine. But knowing what is good and what is not good should be the important chapter for all of us. Now, any kind of oxygen sats which is greater than 96, we don't really worry about it. Most of the COPDs with chronic obstructive lung disease will maintain their oxygen sats at the level of 96. Somebody who's between mild would be 90 to 95, and a moderate would be 80 to 89. So most of my patients who have chronic obstructive lung disease, they maintain oxygen sats around 89 to 88. That's a common oxygen sats for them. Somebody who's very severe would be greater than 80% of the oxygen sats, or below 80%, I would say. Now, the 4-day fall oxygen 6 minutes walk test. Now, in COVID-19, we are saying that all of you will need a pulse oximeter to measure how the oxygen capacity is. But it's not like just simple sitting and measuring it. You need to be doing a 6-minute walk test. Like you walk from one room to another room and have a pulse oximeter, see whether the oxygen is falling about, like 6 degrees, like from 98, it just fell to 94. That's the cause of worry, and that's when we say that you would need help from critical care units and you might need supplementary oxygen. Otherwise, there are various types of breathing which we keep the lungs alive and we keep your alveolar sacs being maintained well and functioning well. So this kind of rehab in this 6-minute walk test actually originated or developed for the cardiac rehab, and it was for very much reliable test, and patients walks back and forth and about 6 minutes, and we measure the distance he has walked, and then it covers the fatigue, the shortness of breathlessness he has had, and we measure how he feels, how the situation is, and it gives a very detailed study of how the patient would believe. Now, just touching basic points on how inhalers, asthma, and COPDs would work in the times of COVID-19. Anybody who's asthmatic, anybody with COPDs are on these inhalers, which is a reliever inhaler, which is the blue color inhaler, which is mainly the salbutamol, and you would have a steroid-based salbutamol combination, which we say the antimusmeric. We'll have like something like Tioga, Jonel, which is for COPDs, which we give, and bromelain or chromaline inhalers. So any of these inhalers should always be there for somebody who's asthmatic and COPD. So in both of their functions are different. Salbutamol is more like a Ventolin, which will help to dilate your airways, which are restricted in an acute asthma attack. We need to take it, but something which is a preventer, which you got to take it early in the morning or before you go to bed, just to prevent you from your lung capacity to not just decrease, to prevent you from any allergic reactions when you have it in the night. So steroid has an anti-inflammatory role, and the low molecular dose of this steroid going into your lung and airways helps to keep your airways relaxed and calm, prevents you from any long-term inflammatory reactions in the airways. Now, rescue breathing is very important to help you control with the rib pain. So you kind of stop at a place and try kind of take in oxygen and slow down and exhale out. Stop and exhale, stop and exhale. This is very important breathing control because the moment you get panic, you tend to breathe faster, use up all the oxygen, and then the inhalation and the exhalation process is really getting a challenge. So we have to really work on rescue breathing for COPD patients and also in terms of pulmonary fibrosis for COVID-19 patients. You all can always put your questions down below my comment section and like and subscribe this video, and we get to come back with more questions and answers for you. Um, so, as we said, COVID-19 has brought us to a very different, challenging situation where our capacity to exchange oxygen and carbon dioxide exhalation is being challenged because our stiff alveolar walls, which should exchange gas, is not happening. With our pulmonary rehab protocols, we are working all throughout 24 by 7 with all our patients and all our clients, and we are teaching a lot of physios all around the world how they would help patients recover out being at home also, or somebody needing exclusively very challenged pulmonary rehab, they have to visit a hospital and be with the respiratory physiotherapist who would make you lie on your tummy, and prone lying would help to expand your lungs, as we know that. So, very vital key points here are do the 6 minute walk test. If your oxygen sats fall below 95%, that's something which we really need to address on an urgent basis, on an emergency basis. Keep your rescue inhalers and your preventer inhalers if you're an asthmatic and a COPD patient. Make sure that you are following the rescue breathing pattern if you are an asthmatic and a rescue and a COPD patient. So that's all about from Dr. Anjali. I have been working a lot in the cardiopulmonary rehab field. We launched it in UK and in London, and it has been a beautiful chapter by being back in India and having introduced us in our high tech city chapter for a lot of my patients who are lung fibrosis, with COPD, with interstitial lung disease. And we have had all their elderlies with this disease, comorbid conditions, and they really fared well with the pulmonary rehab. So I suggest if you have any questions and if you really need to book an appointment, go forward and dial in Dr. Anjali at 8790 465 446. Thank you. Namaste. Stay well, stay safe, maintain the social distancing, maintain your hand washing techniques, and smile more. Don't take tension. The battle has not already been won, but we are there together. Let's fight it together. Thank you, everyone. Bye bye.